Do I have to talk it out? What to say during the clinical skills. A presentation brought to you by 4YourCNA.com. One of the most common questions we receive is, do I have to say everything you say when I'm doing the skill? And the answer to that is a little more complicated than a simple yes or no. To understand, we have to think about this from the patient's point of view. So let's think about the patient for a moment. Patients are in a strange environment. There are lots of strange noises, various beeping sounds, and alarms going off. They are often attached to complex machines with lots of complicated buttons. They're in a completely unfamiliar environment, all alone. It's a really scary place, and they're surrounded by strangers. They have a stranger for a roommate, and every person that walks into their room is a stranger. That's a lot of strangers. Now, the real problem is that most of those strangers will hurt the patient in some way. Doctors perform uncomfortable exams and procedures. Nurses use needles to start IVs and give shots. Respiratory therapy performs painful blood gas draws from arteries. Physical therapy performs uncomfortable exercises and stretching. Phlebotomists use needles to take blood, often sticking the patient many times. X-ray techs place patients in uncomfortable positions on hard surfaces to obtain the right angle for images. EKG techs place sticky pads on the patient's body, then rip them off, removing lots of hair. This is not a comfortable place to be. Now, when you enter the room, the patient has no idea what to expect. Since everyone else has hurt them, they expect your tasks to hurt too. CNAs are never supposed to hurt a patient, but your patient won't know that. So that patient is going to be fearful and apprehensive because they just don't know what to expect. You know what step is next and what you're about to do, but how in the world is your patient going to know? They haven't gone through CNA training. They don't know the next step. The only way for them to know what you're going to do next is to tell them.
I'm going to put this privacy blanket on you.
Telling the patient what you are doing will make them a partner in their care, which helps them relax and ultimately become more cooperative. Remember, we're there to help the patient, not boss them around. They're not prisoners. If they aren't aware of what we're doing, how are we helping them? Patients are not medical professionals. They don't know what every person's role is and what they're there to do. Just like you had no idea how a skill was supposed to be done before this course, your patient does not have any idea of how the skill is done either. You had to take a class to learn what the steps are, but your patient hasn't taken that class. So the only way the patient will know what you're doing is if you tell them what you're doing. It's actually your job to tell them. So as you perform the skill, you should tell the patient the steps you are taking to put them at ease and gain their cooperation. Think of it this way. If you were the patient and a stranger was touching you, wouldn't you want to know what they were doing? Silence between strangers is awkward. Silence when one stranger is touching another is creepy. So talking the steps out loud helps the patient. But during the exam, it can also help you. During the exam, you will be nervous. That's natural. But being nervous can make you forget steps. Saying the steps out loud to the patient actually helps you remember the steps. By talking out the skill, you begin to focus on the patient rather than the test and the fact that you're being graded. Plus, the evaluator will be looking at their checklist, which means that they may not actually see you do a certain step. But if you're saying the steps out loud, then they will hear a step, even if they don't see it. So you would get credit for it. Remember, the videos are teaching tools. So on the video, the instructor is talking to you, the student, explaining how the skills should be done. So that is going to affect what they say out loud. Since you're not teaching a class, you don't have to say everything exactly the way the instructor does. As long as you're telling the patient what you're doing in your own words and what to expect during the skill, you will be performing correctly. This is graded under indirect care, and not talking to the patient about what you're doing can fail you. So, since it's good for you, Good for the patient and good for the test. Talk it out.